new technology is a little different for me. So I want to welcome you here and thanks for being here. It is just a few minutes before noon. I wanted to make sure I could get this up and running before we get started. And what I will do for you is oh, number one, I'm going to stop the share of my screen for a moment so I can set that back up. But I am here to shine a light on eating disorders so that we can learn a little bit more. So, if anything that I speak about today triggers you, please know that share screen again. Okay, there. All right. So interesting. All of this, I believe. Yep, we are going live. So, there you go. Excellent. All right, let me get started. I'm going to get started because it's 12. And thank you for being here. And I'm hoping that this is being live on Facebook on Shaping Perspectives. My name is Ann Poirier, and I am the founder of Shaping Perspectives, A Woman's Way to Joy. And what we do is we work with women struggling with weight, food, eating, body image to shift their perspective around themselves and around their bodies and around food and eating and self care and mindset. So it's a comprehensive approach to our wholeness and how can we shift our perspective, because a lot of times it's our perspective that keeps us stuck. So we're going to talk about this is a basic kind of overview of eating disorders. I am going to shut off my video and I am going to get started for you so that if you have questions, please feel free to comment and I will come to them at the end. So comment in Facebook and I will come to them at the end. All right, so let's get started. So, what we're going to do today is just shine a light on eating disorders. So, if as we discuss, there's anything that you hear that is familiar, or if you think you may be it on the edge or have an eating disorder, screenshot this, take a picture of the helpline. At the end, I will make sure to post all the help available. We have it, we've been posting it all week. We will be posting it as Eating Disorder Awareness Week travels through. So reach out, ask for help, talk to a friend. If you have a friend that has an eating disorder or is and today you might realize that they may, you know, we're going to share what you can do, how you can help, what you might be able to help them with, and how you can support. So let's look a little deeper into what eating disorders are. We know that they're life threatening, and I'll tell you, over 10,000 people die from an eating disorder every single year. That's one every 52 minutes. And 26% of people with an eating disorder also attempt suicide. And we're going to touch on that in a little while. An eating disorder has extreme emotions and behaviors all connected to food, eating, weight, so numbers on a scale, and body size. So there's emotions. So there's a hard charge around weight, food, and size. So that gets people anxious. And then there's also biological. So we're going to dive into this a little bit. So there's some genetic components to this, psychological, our emotions, and then socioculture, which is our environment. So it's all of that. So who do eating disorders affect? They affect people of all genders, all races, ages, religions, ethnicities, sexual orientations, body shapes, and weights. Anyone you see on the street could have an eating disorder. 20 million females and 10 million males will have eating disorder symptoms in the course of their lifetime. So it's important to realize that it there's a stigma of, especially, in the 80s and 90s, of the white middle class woman was the only they were the only people that would get eating disorders, and we know that's not true. And so realizing that it hits everyone, and let's talk about some of the ways that eating disorders appear. So there's biological factors. There is connection to a family history. And if you think about family history, what do children grow up in the family like? So if mom and dad or mother or father or aunt or uncle are always dieting or are always shaming their bodies or shaming other people due to the size of their bodies, that's going to play a part of a belief system in the children that are growing up there. So there's family history, the history of dieting. So if you've been on diet after diet after diet after diet, we know that dieting is a precursor to eating disorders. So that's a really important fact to realize, that if you have been on multiple diets, that we want to look at that and take a different view, and look at food and eating differently, look at your body differently, and see how we can see a different perspective. Type 1 insulin dependent, and then genetic predisposition. There are some genetic variants associated with eating disorders. So there's biological factors, so our physiology. There's also psychological factors, low self-esteem, relationship with yourself and as far as confidence, self-worth, feelings of inadequacy, not fitting in, not belonging, depression, anxiety, fear, worry, loneliness, isolation. So there's some psychological factors. And then on top of that, we have social factors. So we have a society, quote unquote, society's thin ideal, right? Which is the cultural norms that we need to look a certain way, that are overvalued in appearance. Body dissatisfaction, not feeling good in our bodies, which can lead to body dysmorphia, where you don't see what the mirror actually reflects back to you. This drive for the perceived ideal, which is what we see on media and social media, especially today, where we see it over and over and over again. You can't get away from it. You can't escape it. So there's a drive for a perceived ideal. And if you look back over this century, the perceived ideal body type has changed. And so it's ever changing perceived ideal too. Historical trauma of a history of trauma, and a history of weight stigmatization and bullying. So there's a lot of things that come into play for someone when they are in active eating disorder. So this presentation comes directly from the National Eating Disorder Association. And they have found that these 9 truths are really important for people to just understand, because it is misperceived quite often. So many people with eating disorders look healthy, yet they may be extremely ill. So there's a tendency to think that if someone has an eating disorder, they must look a certain way. We know that that's not true. varies of sizes and shapes and weights and cultures, like we talked about, races. So it is important to realize anyone can have an eating disorder. Families are not to blame. They can be the patient's best allies in treatment. So there's a tendency for parents, for a child to blame themselves um, because a child has an eating disorder, and it is not the family's fault. As we see, we've got a series of different things: physiology, psychology, and social in our environment. So it's not just the family environment. There's more to it. An eating disorder diagnosis is a health crisis, and it will disrupt your personal life, your quality of life, your family functioning, your relationships. It will disrupt your life. Eating disorders are not choices, but seriously biological influenced illnesses. So when you think about biology of starvation, the body does not have its immune system is compromised. The brain is not nourished, which means it's unable to think clearly, right? So there's a series of different reasons for an illness. It is not a choice. Someone doesn't choose or decide to get an eating disorder. It's kind of that perfect storm of your history, emotions, your physiology, and your environment. Eating disorders affect people of all genders, ages, races, ethnicities, body shapes, weights, sexual orientations. So I already discussed that a little bit, but it can hit anybody. In eating disorder treatment, there are children as young as 8 and 9, and there are adults as old as 75 or 80 years old struggling with eating disorders. And I know some of those older people myself. Um, Eating disorders carry an increased risk for suicide and medical complications due to the immune system being compromised, no matter what the eating disorder. Genes and environment play a role, right? So we know that there's some genetic variations. And then we think about our environment, whether it's the home environment, the school environment, if there's bullying and weight stigmatization, the work environment, your friend environment, right? So there's a lot of different things. What are you watching on TV, or what does your social media feed look like? So the environment as well as genes, they play very important roles. So we can, when we look towards recovery, we need to make sure we look at environment in a lot of different ways. Genes alone, on the other hand, do not predict who will develop an eating disorder. And full recovery from an eating disorder is possible. Early detection is really the key. So, tomorrow we're going to talk a little bit more about warning signs, and I am going to show a video at noon right from the National Eating Disorder Association so you can see a little bit more on warning signs and signals. So, thinking about this is kind of a basic overview: emotional and behavioral. So, you will see weight loss, you will see dieting, control, controlling food rituals, you know, a person's way of eating shifts dramatically, usually. Uh, there's social withdrawal, isolation, saying no versus saying yes, frequent dieting, obsessive compulsive, sometimes search for the new diet, the next new diet, the next thing. So that can be, going down the rabbit hole of the internet, trying to find what's going to work for me. And then body checking. And if you're not familiar with body checking, that's pinching thighs, or, always looking in the mirror, checking, fixing, pulling at clothes. Those are kind of body checking behaviors. And then extreme mood swings. So swinging back and forth. I remember, um, when I was one things that I always think back on in my own anorexic nervosa journey was how kind of horrific my moods were. And then there's physical, right? So there's noticeable weight fluctuations. Sometimes there is, sometimes there isn't. Gastrointestinal constipation, diarrhea, right? Gas, not feeling good. Dizziness upon standing, that's lack of nourishment to the brain. Difficulty concentrating and sleeping, right? So the body's not getting what it needs, no matter what the eating disorder, if it's either getting um, overfed, underfed, there's there's other behaviors that get linked in that causes other issues in the body, and issues with dental, skin, hair, nails, right? So you can see some of these things as well for warning signs. And again, we'll do a little bit more on that tomorrow. So what we're going to talk about just for a minute here is the DSM-5 diagnosis. We're going to share just a few of um, the eating disorders you hear most about, right? So there's anorexia nervosa, characterized primarily by self-starvation and excessive weight loss. A person does not have to be in a small body to have anorexia nervosa. Someone can be in a different sized body and still have anorexia nervosa, but it is characterized by self-starvation. Bulimia nervosa, characterized by a combination of binge eating and behaviors to compensate for whatever the binge was. So, purging, self-induced vomiting, in attempt to just undo, and then feelings of shame. Binge eating disorder. I want to share a little bit about this, characterized by recurrent binge eating with regular measures. So it's not a binge purge cycle. And the DSM-5 on binge eating, it is eating in a discrete period of time with lack of control, a large amount. And then it also has a couple of other kind of underlying symptoms, rapid to uncomfortable fullness, alone, then feeling disgusted. So some of those are, that's kind of this binge eating disorder, what the DSM-5 has kind of pulled together. And then in order to be diagnosed with binge eating disorder, binges need to occur one time a week for at least 3 months. So that's something to just be aware of for everybody that you know. Um, I tend to think sometimes binge eating disorder is overlooked. So then there's avoidant restrictive food intake disorder, lack of interest of food, fears of negative consequences. This is when foods tend to cause reactions in the body that don't feel good, which then lead to beliefs about, beliefs and thoughts that, oh, if I eat this food, it's going to make me feel like this, and I don't want to eat this food because it doesn't make me feel good, and very selective and picky eating. And then they have a whole series of OSFED. This isn't all of them, but some of them. Atypical anorexia nervosa. So that's what I talked about a little bit before. Meet the criteria for anorexia, but the weight is not low. Subthreshold bulimia nervosa, less frequent behaviors. Subthreshold binge eating disorder, just less, not as frequent. Purging disorder, purging without binge eating. Nighttime eating excessive, nighttime food or compensation. There's also rumination and pica. So there's a series of other relationships with food that can be very dangerous. So if you notice someone having a shift in their relationship with food or the relationship with their body, that's cause for concern. Also, we know that with eating disorders, there are some very common comorbidities. These are just some of them: depression, anxiety, OCD, alcohol, self harm, PTSD. The most common are mood disorders, so some type of mood disorder like depression, anxiety, and substance abuse. So when a person goes for treatment, there's a look at what are the common comorbidities they might have, because both need to be treated, not just the eating disorder or not just the depression. There is a tendency for an individual with an eating disorder to not think they have a problem, especially if they look healthy yet might be ill. Eating disorders are often, and this is what I started with, right, are often viewed as a disease that only affects affluent white women. It affects everyone. And what they all have in common, all the different types of eating disorders, from binge eating disorder to anorexia nervosa to rumination, right, is extreme emotions, attitudes, and behaviors surrounding food, weight, and size. I'll say that one more time. What they all have in common: extreme emotions, attitudes, and behaviors surrounding food, weight, and size. So let's talk for a few minutes about seeking treatment. Getting early intervention is key when it comes to full recovery of an eating disorder. We know it is serious and life threatening. We talked about that at the beginning. It has the second highest mortality rate of any psychiatric disorder, surpassed only by opioid addiction. It has a serious effect on our health, our productivity, our relationships. It impacts everything. It impacts the whole family. So there's a, as far as lifestyle and quality of life and relationships, all of that gets flipped upside down during an eating disorder, and nothing quite seems the same. So, eating disorder treatment starts with that intervention. It starts with someone saying, I have a problem, I need help, or with people close to a person with an eating disorder intervening, an intervention. So, it starts there and then it moves into some professional treatment. An eating disorder isn't something that will be recovered or resolved in one treatment session. It is something that is layers and layers of work to find their root. It's not just about food, it's not just about body size. It's peeling back the layers to find the root of why the behavior started to exist in the first place. And then it requires ongoing support before there's recovery. But recovery is possible, and we know that. So, admitting there's a problem, seeking professional help, and continued support. Those three pieces of the puzzle bring you to recovery. And it's very common to have a, you know, two steps forward, one step back kind of approach when it comes to eating disorders as well. So, moving forward, things are progressing, and then having kind of a backslide. So, that sometimes happens too. So, it's just kind of comforting to know that. There are different levels of care, and I'm going to just explain a little bit about the difference of these. So, the levels of care start with, if a person is medically unstable, they start with inpatient. So, if a person has an eating disorder and is at a particular place, either medically or psychiatrically unstable, they go into inpatient because they need medical supervision. So that's the key. So, someone that might be suicidal or someone that is malnourished and can't think for themselves. So that would be an inpatient. Residential is a patient who is medically stable but is unable to respond to partial hospitalization. So they stay overnight. They are monitored 24/7. Partial hospitalization needs daily assessment still, and yet goes home to sleep. So it's a full day program. There are lots of different types of programs, but partial hospitalization is a full day program. But the patient goes home to sleep and then comes back the next day. Intensive outpatient, they vary, but they're usually daily for a few hours. So it's intensely continuing with this outpatient connection because going too long slides, it opens the door for sliding backwards. And then finally, we have outpatient, which is your regular, like a once a week. Sometimes outpatients go Monday, Wednesday, Friday for a couple of hours. So you're getting a little bit more support. So the outpatients can be very different too. So these are all depending on where you are, your medical stability, your psychological stability, and then how you respond. Eating disorder recovery is not a straight line. It always depends on, comorbidities, the length of the eating disorder, the type, etc. So the key is to have ongoing support from families and friends as people move through these levels of care. So National Eating Disorder Association has a series of different types of support. So you can screenshot this their phone hours, their 24/7 crisis support, helpline to chat. So if you feel you need help or someone you know needs help, let's start the conversation. Sometimes we don't know. It's kind of what I mentioned at the beginning. If some of these things, as we've talked today, have made you have a feeling of, that's me. They have an eating disorder screening tool that you can click on. 97% of participants identified as at risk. There are hundreds of thousands of screenings taken every year. It's a quick access tool to realize where you are on the spectrum and if you need help. Asking for help is strength. It is not, I think sometimes asking for help, people feel weak, but it's a courageous step forward for your recovery because you're worth it. NEDA has toolkits for all kinds of things. And then tomorrow, like I said, we're going to tune in tomorrow for warning signs and symptoms. And I'm going to share the What is an Eating Disorder brochure. So I'm going to come back to video and say hello and thanks for watching. Now I'm going to slide over to see if there's any. I do not see. Okay. Not sure if the whole thing went live or not, but I did record it on Zoom. So I am going to upload this to Facebook because that is the other way that we can do this. So thanks for watching, and I hope you have a good day. If there's any questions, please stay with us all week long. Number one, stay with us all week long at noontime. And then this is the only live webinar. So If it's not at noon, it will be. Uh, and then if you have questions or concerns or want to reach out for help, please know that my heart is here.